Hi everyone, my name is Rudy Mercado. I'm a licensed clinical social worker. Currently, I am a licensed clinical social worker, an LCSW. I'm a psychotherapist. Right now, I'm conducting psychotherapy with my patients. In order for them to qualify for psychotherapy, I do an evaluation, a behavioral health evaluation. I provide a diagnosis. Diagnosis can be provisional, meaning it could be something that I had to further look into, but sometimes I could determine the diagnosis within that time frame. During my next couple of visits, I get to know my patient. I establish a treatment plan, and we work on goals for therapy in which the patient or client wants to improve on or work on, for instance. I also do recommendations as far as psychiatric services. I also coordinate for case management services, and I also have a case manager who assists me in providing those services. What I've done is I've gone ahead and get my master's degree in social work. I did 3 years of my master's here locally, and afterwards I've accumulated over 3,000 hours of supervised clinical experience in direct practice. With that, I'm able to take the advanced board exam for the state of California. And once you pass that exam, you're deemed competent as a psychotherapist. And at that point, you're able to open up your own practice or work in a field in which you can provide therapy and also be a supervisor of other undergraduates, interns of the social work career. Currently, my work schedule is Monday through Friday. I'm working 7:30 to 4 p.m. Yeah, my work schedule, I'm scheduled 8 patients a day. I do 45-minute sessions for individual sessions. I do an hour for the intake assessment. And I'm also provided admin time in which I'm able to document my therapy sessions or my intake. Well, my story is I was born and raised here in the Valley. Um, at first, I didn't want to go to school. School was not for me. I left in order to, join the workforce. I enjoyed that for some time. However, due to unforeseen circumstances, I was forced to have to move back. It's kind of difficult to make it in a big city, especially without no family. Family is a huge strength that I believe most of my patients would benefit from having. I think that if you don't have supports, it's very difficult to improve as far as your emotion and your psychological well-being. I came back for my supports, and when I came back, I decided that I wanted to pursue um, my education. I wanted to focus on counseling at the time, work with drug and alcohol addiction. Uh, During that time, I was just thinking about a 1 year certificate in alcohol and drug studies at IBC. However, my interest grew profoundly for psychology, and I pursued my psychology degree and transferred over to San Diego State University campus here in Imperial and Calexico, I'm sorry. After that, I really enjoyed psychology. I was really invested. I did research. I really loved how you could determine behaviors and outcomes with data. I wanted to pursue psychology full time. I wanted to get a doctorate. However, due to, again, some circumstances that were beyond my control as far as the logistics, including financial stresses, I had to stay locally. The social work program opened up there, and social work, I used to see it as individuals who come and they take the kids away from you. They remove your kids, or they're giving out welfare and food stamps, and they're tending to like the schools and to the medical the medical field. However, I didn't know that they provided therapy as well. So after getting that knowledge and understanding the dynamics of the degree and the diversity of it, I decided to pursue social work. And the discipline was direct practice. So at that point, I was given the option of being administration or direct practice. I had juggled between the both. I wanted to be a boss, but at the same time, I also wanted to provide therapy and get the benefit of seeing someone improve and just become a healthy, functioning individual. So I pursued direct practice, and that led me to where I'm at now. I felt the time in my career where I felt the most rewarded. Just given the opportunity to work for our county and give back to our community, I think was one of the greatest rewards I've ever encountered in my career. Um, there's an oath that you take when you get hired at the county, where you agree and you take the oath and you vow to provide the community with the utmost outstanding service that you can provide. And I believe that was one of the highlights of my career. Um, in addition to that, getting my master's degree and getting promoted from a case manager to a clinician, in this case, a psychotherapist, right? That was another one of my biggest rewards. And then, yeah, ultimately where I'm at right now, where I'm licensed. At this point right now, I could either work for an agency. I can also go ahead and open my own practice if I'd like to as well. Uh, you know, the I would say that if you want to get paid, it's and you want to get rich, you don't want to come and get a degree in social work. I think that the pay is good, and I think that you're going to be comfortable for sure. But the reward is going to be when you help your clients. The reward is there when someone trusts you and allows you to come into their world and they share everything that's been bothering them, that they've been dealing with for years, and they're finally ready to meet those, kind of help themselves and kind of face some of the struggles that they've encountered throughout their life. I deal with trauma. I have individuals coming to me to speak to me about trauma that they've encountered early on in their life, about their grief, about their depression, about the families and their dynamics, their substance use. These individuals are hungry and they want help. Sometimes they just don't develop a good rapport with clinicians, and they never get the help that they want. But if you're genuine and you're compassionate and you could be there to provide them just that ear, that shoulder to lean on, they'll definitely benefit from that. And at the end of the day, it really comes down to a lot of documentation, but the reward is that you don't feel like you really worked. It's really like you're really helping out. You're really helping someone, and that is a long-lasting reward. It has a long-lasting effect. And for those of you who are considering social work, I say you stick with it. There's a lot of work to be done. Social work is very diverse. It's a lot different than other clinical degrees. We focus on policy, from program development, program evaluation, clinical practice in all areas, well trained in those areas. We're trained in substance use. So it's pretty diverse. We're trained in crisis intervention. We're trained in law and ethics. So we're pretty diverse. That's why we're highly coveted throughout the state of California and throughout the nation. A degree in social work can pretty much get you a job anywhere in the country. Well, I would say maybe the types of jobs that you could have as a social worker. As a social worker, you can definitely go work for the Department of Social Services. You could become what they're termed as a social worker. Do case management. You could work with Child Protective Services. You could work with the adult population, adult protective services. You could go into geriatrics and work with the elderly. You could go into the school settings and become a school counselor. You can also go into the hospitals and become a medical social worker. You could go into the prisons and become a social worker there as well. Right now, I consider myself a psychotherapist. I am in a healthcare facility. I'm not completely a medical social worker as you would consider as some of those in the hospitals, as I'm outpatient, but very similar. Social work lends itself a lot to a lot of different types of career choices. It just really comes down to the population that you want to work with. And I forgot to mention substance use disorders.